Well, good morning. Welcome back to the Broadcast Retirement Network. I'm Jeff Snyder. This is BRN AM for Tuesday, May 31st, 2022. And our top story today, we're going back to basics with proper dental care and its impact to your overall health. Well, joining me now to discuss this and a lot more, Jamie Dudley is with Towson Dental Care. Jamie, it's great to see you again. Thanks so much for joining us on the program this morning.
Good morning, Jeff. Good to see you too.
It's always good. I always learn a lot from you and all of our guests, quite frankly. But I'm really interested in this one because I want to make sure that I get my sequencing of my brushing and flossing and the number of times I do it every day down. Before we begin that, are you seeing more patients kind of trickle in now that the pandemic is quote unquote over?
Definitely seeing a lot more influx of patients who are starting to return. Even just new patients that haven't been anywhere because of the pandemic. So yes, we're starting to get our numbers back more to pre-pandemic currently.
And I would imagine that you're picking up on things as you're cleaning teeth and going through the checklist with clients. I'm sure you're seeing certain trends pick up. Top of mind probably is how people floss and clean.
Yes, sometimes it really just boils down to going to the basics of how you're brushing, how you're flossing, even things like rinsing. So I like to go over this with my patients, especially when they first come in, because assuming that everybody does certain home care or teeth care hygiene practice, it's not always happening. So I like to start with the order that we should go into practice proper oral hygiene. And I go right in for the mouth rinse first. I like to get a good rinse. Right after the rinse, I actually will floss my teeth. And then I will pick up my toothbrush and I will do my brushing at that point. So that's typically going to be the most effective way. At the very end, I do like to do a fluoride rinse after all the surfaces are clean.
So just to be clear, you're actually you suggest rinsing the mouth first, flossing to get some of the stuff out in between the teeth, then clean the surfaces with the brush. And let me ask you about the brush itself. Do I need to buy? I do have an automatic toothbrush, a Sonic Care. But do I need a automatic toothbrush, or can I still get away with the Reach or the generic over-the-counter toothbrush?
Sure, you can absolutely get an effective brushing with a manual toothbrush. Do I personally feel you can be more effective with an electric toothbrush using it properly? Yes. However, you can do a fine job with a manual toothbrush, but the keys are to making sure that you're using the right angle and properly brushing so you can remove as much of the buildup, which is what causes the irritation and the beginning of all of our problems. So for example, after I've rinsed my mouth, usually just like a basic Listerine, I will then floss my teeth. I prefer some kind of basic string floss, floss on a stick, no problem. But I like to make sure I like
that you brought props. I mean, candidly, you're in your office, so you should have access to props. But I like that you brought pack. Does it matter if you buy over the counter like generic floss? Can you get away with, do you need the mint flavored, the waxy type of floss? There's probably 30 different things to choose from in the store.
It is overwhelming when you go down those aisles. To answer your question, it really comes down to the preference of the product that you like. Some people like a thinner floss, a thicker floss. Some people will only use the floss on a stick. But when it comes to The brands, it is really more relevant to your preference. It is nice to see what's called the ADA seal of approval, American Dental Association seal of approval, especially on your toothpaste. But with regards to any of the hygiene products, toothpaste, floss, the most important thing is getting the product that works for you. So off brands, as long as they're doing the same thing, not a problem.
Let me ask you about kids, and how do you, I know you have a pediatric practice at Towson Dental Care. How do you, it's one thing for an adult to floss, right? And wrapping and doing that and the technique. How do you get your kid who's 5? Now, they may not have their permanent teeth, but they got teeth. They should learn the basics of flossing early. How do you instill in them the ability to floss and know what they're doing? Or is it more mom and dad just do it for them?
Probably a little bit of both. I think the main thing is just from a very young age, just having them watch you. And yeah, anybody who lives in the house, their regular hygiene routines, get them involved. I have a almost 5-year-old, and I tend to brush my teeth and floss at least every night with him, because he then of course wants to do the same thing that you're doing. So that's, I would say, probably the best way to do it. We do read books and watch little videos also, but just making it as normal as possible and just letting them do it, and take a piece of string floss or give them the tools and just let them try and back them up when they need it.
Yeah, and how about and I'm sorry for asking these more detailed questions. I'm just really curious before we get into the brushing, which I think we're going to have to go in the second segment of the show. But how hard should you floss? Because a lot of us, myself included, have this is TMI, but have very soft gums, or gums that are very sensitive. Do you need to get in there and dig hard? What's the right feel for it?
That is a really good and important question too. Bringing my piece of floss back up, whether you're using a piece of string floss or again, floss on a stick, you definitely want to make sure that you get the floss between your teeth and all the way down to what we call the sulcus, which is just the space at the bottom of the teeth. So.
And you have nice teeth, by the way. Thank you for demonstrating. I'm just going to navigate while you're talking. Since you can't talk, I will say that you have very nice teeth. Did you have braces, by the way?
I did. I had braces, and I'm actually in a Invisalign case right now too, touching them up.
Okay.
But to answer your question, Jeff, you can put too much pressure with flossing, so that's important. We can get back to that for a quick second when we come back from the break.
Yeah, I would imagine that bleeding is an indication that you've gone a little too far and probably don't want to do it. Last question for this segment. What if you have some gaps in your teeth? And there are a lot of us who didn't wear their retainers or not going through the Invisalign again, even though they may need it, myself included. Should you double up? Because, you might get in that space and you don't touch anything. So should you double up on the floss so that you have double the floss and therefore double the thickness?
I like that. I like that idea. But no. So the important part is flossing properly. You want to make sure that the floss goes in between your teeth, but you want to make sure the floss is going all the way up and down.
There you go. Yeah, I see that. It is going up and down. There you go.
You do not want to do.
Yeah.
No back and forth. I say back and forth, up and down. But when you have extra space, it's all the more important to make sure you're flossing using tools, even like what are called interproximal brushes or proxa brushes. They look like little Christmas trees on a stick. I will show you one after the break. There are water picks or water flossers, they're called. They are fantastic for everybody with teeth to have. They also help to irrigate and get out anything that the floss brushing, rinsing leaves behind. So,
this is exceptionally helpful, and at any age, whether you're 5, 4, or if you're 55 and above. Jamie, I need to take a quick break. When we come back, all right, we're going to hit the surface of the teeth. We're going to talk brushing. When we come back, you're going to want to stay tuned right here on BRN AM. Imagine a new television network that will make you richer, healthier, and in control of your financial future. This network is for the policewoman in Nashville, Tennessee, the baker in Dubuque, Iowa, the teacher in Lexington, Kentucky. We want to make the idea of savings and retirement culturally relevant. But what do you see as a defining issue of the midterms? Especially for the smaller businesses. I mean, they are the lifeblood of the American economy. Featuring exclusive interviews, current affairs, and docuseries. 33 years old, you retired early.
The philosophy is money only matters if it helps you live a life that you love.
But you got to start thinking about retirement as soon as you get in.
The Broadcast Retirement Network will drive very high engagement with premium partnerships. So this isn't retirement and savings for your parents or grandparents. This is for all Americans. And we're going to change the way you think about money. Welcome to the next frontier of retirement and savings. This is BRN, the Broadcast Retirement Network.
Are you over 50? Would you like to get up to 33% more income in retirement? Then call now for this free book, Annuity Do's and Don'ts for Baby Boomers. This free book reveals little-known secrets about annuity strategies that will help you make the right choices before buying an annuity. Call right now for your free book, and as a bonus, we'll also throw in a free annuity rate report, both absolutely free for calling Annuity General today.
Call 800-504-8194.
Welcome back. We're talking this morning to Jamie Dudley of Towson Dental Care. Jamie, thanks so much for staying with us this morning.
Thanks, Chuck. Glad to be here.
It is great to have you, and thanks for the demonstration. And I get to narrate a little bit while you have your mouth open and you can't talk. But let's now talk about cleaning those surface areas of the teeth and the tongue. Okay, you're going to demonstrate this. What's the best approach? How do I hold my toothbrush? Do I need to have it at a 90-degree angle, an 85-degree angle? What's the right approach there?
Well, let's start with the teeth first. Tongue is very important to brush also. I typically do that at the end. But the more important part to brushing is getting your toothbrush bristles at about a 45-degree angle, or just an angle towards your gum lines. So, for example, and you want... Mm-hmm.
And it's more of a massage than it is a brush. I see you kind of going in a circular motion. Is that the right approach? And how hard are you doing this?
So you want to be light, a little more than light massaging. I like that term. You do not want to press too hard because you can thin the enamel, which is the outer coating of our teeth. We can actually brush our gums, which are the pink part around your teeth. We can brush them away too. So it's important to brush with not too much pressure, but also soft bristles or extra soft are very important. And also making sure that when you have that angle, you want to make sure you're brushing your gum tissues. I have conversations every day with all ages of patients who say, oh, I didn't know I was supposed to get my toothbrush physically on the gum tissues. So that is one of my other important takeaways, is making sure you're always getting on the gum, circular, lip straight down. When you're on the inside, same thing.
And if you had that automatic brush, that Sonicare, one of the other Philips, I don't know, there's a gazillion brands. There you go. You have it. How do you just let it go? Meaning you don't press hard and you just kind of let it do the work for you?
So I'll show you on my little model guide. With the electrics, the idea is the same. You want to make sure you have a good angle against the tooth and the gums. The difference is you want to let the toothbrush do the work. So I'm turning this toothbrush on, and you're going to hold it on the tooth at that angle for a few seconds, moving it to the next. Sometimes I like to do a little flip stroke away. So that is the difference in how you use an electric.
Yeah. And Jamie, what if you have stains? A lot of us drink coffee, tea, Coca-Cola, wine. Who knows? It could stain your teeth. You may chew. I used to chew grape bubble yum. That stuff can stain your teeth. How do you said not to brush hard. How do you get those stains out? Do you need a special toothpaste? Do you need a special technique?
I would say to removing anything from stain buildup requires effective, proper placement of the toothbrush and the bristles, and even flossing. Stain can get on all surfaces of the teeth. There are products that are going to be a little more helpful when it comes to staining toothpaste. There are rinses that are going to help there. It's going to be minimal, but the key is daily doing as an effective job as you can to keep that as minimal as possible, going to the dentist a couple times a year and having what we cannot remove on our own, removed by the hygienist and the dentist. But staining is something that most people experience to some degree. There are whitening systems too that are probably best done, especially after you've had your teeth cleaned. And you can talk to your dental specialist about that. But yes, we definitely have options. He is good basic home care.
Yeah, last question. Even if you do everything right, so you floss like we described in segment 1, you brushed all the surfaces, you got the tongue, you are rinsing, there are still things that a dental professional can see when you come in every 4 to 6 months, right? So you don't want to forego visiting the dentist. You still want to go there, see, because they may be able to scale and get things that you just can't remove with a toothbrush.
Yeah, so coming into the dentist every year, a couple of times a year, is important to, of course, remove buildup. But this is a time that we can also see things that, our patients wouldn't be able to know otherwise. For example, things like clenching and grinding our teeth. We see lots of wear manifestations in not only the teeth, but the gums and the temporomandibular joints. We're seeing lots of issues like that. We're seeing cracked teeth, misalignment. So there's a lot of reasons that you want to come in to have a dentist, hygienist do a check. Oral cancer screenings are huge. And just having somebody check out the alignment of your teeth can impact our overall health. We do things like something like Botox injections to help people who have high dysfunction in their temporomandibular joint. So there's all kinds of things that are related to our overall health that a lot of people don't even necessarily think about. But this is what we're here for.
There you go. Well, there you go. And a lot of times this is covered by insurance. People should certainly not forgo the dentist or the regular doctor as well. Get those regular checkups. Jamie Dudley, always a pleasure chatting with you. Thanks for the demos and the very important instruction. I'm going to go ahead to brush right now. Great to see you. Thanks so much for joining us, and we look forward to having you back on the program again very soon.
Thank you, Jeff. It's been great. I look forward to seeing you too.
That wraps up this episode of BRN AM. Have a topic of interest, someone you think we should talk to, drop us a line. And don't forget, for all the latest curated news and lifestyle, wellness, finance, tech, so much more all in one place, check out today's edition of our daily newsletter, The Morning Pulse. Want to search our archives, check out our latest content, or visit our website and our streaming partners. We're back again tomorrow for another edition of BRN AM. Until then, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes.
Waiting here for you to take and drink.
Now is your opportunity to co-create content around any topic on the First Lifestyle and Wellness Network. Reach a global audience through our platform and co-own exclusive branded content. All of our programs are available on demand and also as audio-only podcasts, so you can take us on the go. Broadcast Retirement Network, available anytime, anywhere, and on any device.
Are you being audited and do you owe the IRS $10,000 or more in back taxes? Is the IRS threatening to take more of your money? Don't fight the IRS alone. The Tax Doctor is here to help you negotiate your tax bill and reduce your stress. The IRS can freeze your assets and seize your bank accounts, but you can stop these IRS actions. The Tax Doctor will work with you using our years of experience to represent your case to help you get the best resolution under the IRS guidelines. Help is here to deal with the IRS to reduce your stress. We've handled thousands of cases, so we know what we're doing. If you owe $10,000 or more in back taxes, do not call the IRS alone. Call a Tax Doctor now for a tax emergency analysis.
Call 800-224-6439.